Hello, welcome to Right Parenting Tips. Today's topic is COVID-19 vaccines. COVID-19 pandemic has created a worldwide turmoil. Since there is no specific cure for this virus infection, the preventive vaccination is the proverbial ray of hope. So, what exactly is a vaccine? Vaccine is a preparation, which after administration, trains the body's immune system to fight against specific infection. How does it do that? Vaccine presents either the inactivated or weakened germ or specific antigen from the germ to the immune system. The immune system then starts producing antibodies and activated T cells to fight and remove that foreign antigen. When actual infection happens in a vaccinated individual, the immune system remembers, and is already ready to fight that infection. How are the vaccines made? Using a killed inactivated germ or a live attenuated weakened germ were the traditional methods to make vaccines. Advanced vaccines now use genetic engineering technologies such as recombinant proteins, DNA, mRNA, viral vectors and virus-like particles. How many COVID-19 vaccines are available now? There are at least 9 approved COVID-19 vaccines and more than 50 vaccines in various phases of trial. Talking of the major available vaccines, China's Sinopharm and India's Covaxin are inactivated virus vaccines. US's Pfizer and Moderna vaccines use mRNA technology. UK's Oxford AstraZeneca vaccine and Russia's Sputnik vaccines use viral vector technology. What is the importance of S protein of coronavirus? Novel coronavirus particles have various proteins such as spike protein or S protein, membrane protein or M protein, envelope protein or E protein, and nucleocapsid protein or N protein. Most vaccines use spike protein or S protein as the main antigen to stimulate immunity. How do mRNA vaccines like Pfizer and Moderna work? Here the messenger RNA wrapped in a fat globule is introduced to induce the production of S protein by host cells against which immunity is activated. How do viral vector vaccines as Oxford AstraZeneca and Sputnik work? They use harmless viruses like chimpanzee adenovirus in Oxford vaccine and 2 different types of adenoviruses in Sputnik vaccine to carry S protein gene inside the body to stimulate immune system. How effective are these vaccines? According to initial data, Sinopharm gives 79% protection, Pfizer 95%, Moderna 94%, Oxford 62 to 90% and Sputnik 90%. How long these vaccines will retain their protection will require studies, but Moderna claims their vaccine may protect up to 2 years. What are the pros and cons of these different available COVID-19 vaccines? Killed vaccines Sinopharm and viral vector vaccines Oxford are cheaper and their cold chain storage and transport are easier. They can be stored in normal fridge at 2 to 8 degrees Celsius. mRNA vaccines like Pfizer and Moderna are expensive. They also require super cool cold chains, with Pfizer requiring -70 degrees Celsius and Moderna -20 degrees Celsius for storage and transport. What is the recommended age group for COVID-19 vaccines? Above 16 years for Pfizer vaccine, and above 18 years for other vaccines are the recommended age groups. Currently, these vaccines are not recommended for children. How are these vaccines given? Usually, COVID vaccines are given as 2 doses separated by 3-4 weeks. They are given as intramuscular injections. What are the side effects of these vaccines? The side effects include redness, swelling or pain at the injection site and fever, headache or body ache. They are usually mild and transient. How will the COVID vaccines stop the pandemic? COVID-19 vaccination is perhaps the most important weapon in the battle against the pandemic. Vaccinations will prevent the infections at the individual level, and by reducing the number of infected people, they will also bring down the global community spread. So after the vaccines, can we stop the other preventive measures and return to the normal life? No, this is not going to happen immediately. Till we get a confirmatory data from across the globe about the normalization of risk of COVID infections, we must not let our guard down. The measures such as social distancing, hand washing and wearing masks should continue, even if we are vaccinated. For a near foreseeable future, these combined protective measures are going to be the part of the new normal.